and welcome to your manual lymphatic drainage treatment. It's kind of a mouthful, I know. How you doing today? I see. I hope by the time you leave this treatment, you feel even just the littlest bit better. So what do you know about manual lymphatic drainage? I see. Well, I'll be quite brief in that this is a manual therapy, somewhat akin to massage, but it's not quite the massage you're thinking of. And it's used to assist the lymphatic system to help drain away anything that is out of place. For example, some of our blood might not go back to the heart. The lymph system is the cleanup crew that takes all of that and brings it to the lymph nodes and then recirculates it through the body. Kind of a recycling system, a little bit. So we are going to be assisting that particular process. This is helpful with things like lymphedema, where maybe the lymph nodes are taken out as part of cancer treatment. Maybe you've had surgery, or it can be used for fibromyalgia, chronic fatigue, sinusitis. Really, there's not a lot that wouldn't be benefited by manual lymphatic drainage, right? Okay, so the particular technique we're going to use is based on the fodder technique. So these are the people that originally developed manual lymphatic drainage, and this was actually in the 1930s. So we will be starting with the abdomen just to get everything ready to drain out. And then we're going to be moving to the head, the face, the neck. We'll do the back, chest, and extremities. And it's basically this comprehensive treatment to get everything draining back, everything recycled, right? Okay, so I'm going to have you get comfortable just as we're sitting here and relax as best as you can. And we're going to start with some diaphragmatic breathing, which I'm going to also be working on your abdomen at the same time so that we can start the process. And your lymph system is aided by things like movement, like an exercise, and also your breathing. It is extremely superficial. We don't have to use very much pressure at all. That's why it's kind of like a massage, because we're just doing these very soft movements here. So, are you all comfortable here? Do you mind if I start touching you as part of the treatment? Wonderful. So, I'm just going to be pressing in here in sort of a rhythm. And I'm going to be working with your breathing. So, to breathe with the diaphragm, we are going to take a deep breath in, and you should feel your abdomen rise. It's not going to be your chest, but it's going to be down into the abdomen. Let me take a deep breath in and out. Good. Deep breath in and out. Starting with the descending colon, essentially that area. Deep breath in and out. A couple more as I work around. Deep breath in and out. Deep breath in and out. Wonderful. Excellent. So from here, we are going to come up into the neck here. And we are going to be working the sides of the neck, the backs of the shoulders, the supraclavicular fossa right in here. And what I want to do is I am moving the lymph fluid, moving the skin towards the nearest node. So we're going to do more pressure towards and then let the skin carry us back. Pressure towards and let it carry us back. So that we're directing the flow. That's kind of the wrong way on my hand, but we're directing the flow of lymphatic fluid. So it washes over the body, the muscles. And something like, is it 90 or 95% of the blood comes back to the heart, but some of it gets kind of lost in transit. That's where the lymph system comes in and picks that back up. And then it brings it back to the heart. The shoulders here. There are a few different techniques we'll be using here. We have the stationary circles, which is our big one. We have the rotary technique, the scooping, and the pump technique. And just depending on the area is going to depend on what we do. Stationary circles are great for general purpose, while the scoop is really good for the calf muscle, for the arm. Rotary we can do on the back. Pump technique is also good for the sides, for limbs a bit. Get into the supraclavicular fossa here. There. So how is this? There shouldn't really be much pressure at all. Okay. Yeah, oftentimes when people think of lymphatic drainage massage or manual lymphatic drainage, they are picturing an actual massage. So I'm going to just work the side of the ear here with what I call scissor fingers, where it's just moving around the ear. So oftentimes you have to be kind of clear with expectations, like we're not really doing massage on the muscles, but instead it's more on the skin. Okay, let's do both here. Good. Here, we'll come back into the sides of the neck. And back of the neck, back of the shoulders. There we go. Good. This is just such a gentle and delicate massage, but it can be beneficial nonetheless because it has such a soft touch to it. It feels very soothing and gives a sort of secure feeling. It's more the feeling of being supported, just very gentle. Coming up a bit here. Good. Right here. Good. And then we're going to be moving up. We've got the occipital nodes back in here. I'll be doing a lot of work in the neck and connecting all of this. So in the neck we have nodes like anterior cervical, posterior cervical, and the deep cervical chain. Let me just come back down here, right in the back in this area. A little bit easier for me to get it this way. Good, and into the supraclavicular fossa here. So often we want to do 5 to 7 repetitions of moves is generally prescribed, although certainly we could do more. There is a little bit of variation. It just kind of depends on what we're dealing with and the person. Occipital, back of the neck. Good. Supraclavicular. We can get into the shoulders. We have the shoulder and the back of the shoulder. This trapezius muscle. And we're just working inwards. Always working towards the nodes here. Good, and just bringing that in. Working with the flow of lymph. And then here, shoulder. And the back of the shoulder into the trapezius. And into the supraclavicular fossa. We'll run through this another time before getting into the face. It's very windy today, isn't it? Did you get many leaves falling on you? Whipping around you? Yes, it was quite interesting to see the cascades of yellows and reds and oranges just fly around, circle around. I'd really like to see a dust devil during this time. I've seen 2 before. One of them was actually not too many months ago. The last one was about 10 years ago. Into the submental notes. Alternate a bit. Good. Yes, these weren't very large dust devils. They didn't have a lot of force to them, although the one I just saw recently had much more strength to it than the first. The first one I was an adolescent and riding my bike, and I got caught up in it, but it wasn't much taller than I was. So he just had a bunch of dust flying in a circle along the road. It was there for a few minutes before fading out, and the other one was much stronger but much shorter lived. And again, it was on a gravel area, so you had this big rush of dust, and then it just fell all at once. But I'd love to see a dust devil with the leaves. And submit to people. Good. Yes, the wind causes this large amount of leaves to fall. And it looks like it's raining. Good. Now we'll come to the nodes in the neck. We have the chin here, and working out towards the jaw. Good. And around the mouth here. It's very, very delicate here. Bring that back to the cervical nodes. Okay, and then right by the nose, I'm going to work outwards here. Try it in here. Bring that back to the neck. On the cheeks. It's very cold today. I'm surprised that someone is on a motorcycle. It might feel quite refreshing though. A little bit of drizzle mixed with the leaves and the cooling air. Okay. So I'm going to have you close your eyes. I'm just going to be the eyes here. Good. Okay, the upper eyelid. Good, and you can open your eyes. Right here, sides of the forehead. Bring that down to the ears. And down into the neck here. And the supraclavicular fossa. Fossae, I suppose. Supraclavicular fossae. Excellent. So I am going to have you lay face down so that we can work on your back. So I'm just going to move your arm a little bit here so that I have access to the axillary nodes under the arms. So we are going to work one side and then the other. We're going to start with some stationary circles here on the lateral part of the chest. So we are going to start right above the hip, right in here, and we're going to just bring the skin over and let it carry us back all the way to the axilla here. Just like this. Just gentle circles on the side of the back here. And then we can do what's called the rotary technique on this side of the back. And I'm going to alternate my hands here. There we go. And we'll work from the spine and bring it towards the side, working medially to the lateral part of the back. That sounded like that particular gust moved a few things. So stationary circles right in here. So we move to the side and then we go upwards here, up into the underarm. That's where everything is going to drain here. So we'll take it to the side and then move up. I'm going to use both my hands here for some stationary circles. I'm going to work more at the top of the back. So this particular area kind of ends right here. We have more at the back of the shoulder and then the top of the back here. It's feeling okay? Okay, good. That's good. It's not going to be probably super noticeable when you are done here. And I'm just going to be putting my fingers, this is going to feel a little strange, but I'm going to put my fingers in the intercostal spaces here, and the other one is going to do kind of this pumping motion here. So we work the intercostal area, but it's not going to have very many overt changes necessarily. Except maybe you might feel a little tired, a little drained. While your body is not necessarily working overtime, but it's got this influx of fluid that it needs to drain out and recirculate. Work along the spine here. We're going to use a sort of pumping technique. Each vertebra. But in a couple of days, you might feel like everything just runs a little bit better, maybe. Your body might just feel marginally as it's worked through all of that. It's almost like, I don't know if you get seasonal allergies, but sometimes it happens so gradually that you don't realize that you feel just kind of off all the time until there's a good rain or the temperature drops, and then all of a sudden you feel a lot more awake and alert and just much better than you have. It's kind of like that. So I'm going to do a stationary circle here at the axilla while I've got a rotary circle on the back here. And we're just going to move everything towards this node. And then we will do this on the other side. Probably going to be a little quicker since I won't necessarily have to narrate all of it. Although I tend to anyway. almost my own sort of checking off the mental to-do list, making sure it gets done. First we do this, then we do this. So let me put your arm back here. And we'll move to the other side. So like we did before, I'm just going to move your arm so we can get into the axillary node here. And I'm going to more focus on doing the work since I kind of know the moves here. We have the stationary circles, which I'm going to be doing right from the hip up to the side here. Pump technique, rotary. We'll do a lot more scooping with the arm and leg. Alright, now we'll do rotary. Along the whole back. And the spine, working in this way towards this lateral border. Good. I'm going to move this circle. I don't know if you've noticed too much, but the wildlife's been out in full force. We had a pumpkin massacre because of the squirrels and I suspect as well the deer, and we had a bird feeder casualty because of a big fat raccoon. Dude was huge. I'm going to use both hands here. Bring these towards our base. Yeah. Squirrels, deer, raccoons, possums. Saw my first possum way up close. They are quite interesting looking things. I like them quite a bit. It makes you wonder about their evolution a little, how they got to this point. Okay, and then we are going to just slide the fingers in the intercostals and work towards the middle here. Just want to warn you, because compared to everything else, it's different. It's a little different than just the circles. Good. Right, sea possums and groundhogs. Groundhogs aplenty. I think that's about it. Maybe a skunk or two. Don't usually see them very often. No foxes this year. Lots of owls. They've been doing their territory hoots at night. Then we'll do one hand rotary, one hand circle. The foxes, while cool, I am completely okay with not having around because they like to make their noises first thing in the morning. And it's a little, I suppose, disorienting to wake up to the fox screams. You go to bed with the owl hoots and wake up with the fox screams. Let's bring the arm back, and then we are going to work on the chest. So I'll be working on the opposite side. Now to start with the chest here, I'm going to work on the opposite side that I'm on. I'm just going to put your arm here so that we can work the axilla here. So we've done a lot in this area. We want to make sure that we're not flooding it. I'm just using our stationary circles here to help it open up and drain. And then I'm going to work the chest here. So we're staying below the clavicle. That's our little boundary line. And then we have the waist here. We're going to work up with stationary circles. This is where we might start hearing the clicking and the cracking of the massage table. Good. And then we can do a stationary circle with one hand or rather a pump technique with one hand, rotary circle with the other one. You can just work this, and we're bringing this to the axilla, coming back down, pump, rotary, pump, rotary, reposition. Good. Working this whole area from basically the top of the hip to the bottom of the clavicle. And I've got this midline. Good. Okay. And then we are going to do an alternate movement here. With the rotary, we're going to work to the side and then bring it up. Kind of like how we did on the back. And when I get to the side, I'm just using those circles up. Good. And stationary circles. So we've gotten the upper chest here and the abdomen. But now we're going to work both hands from the sternum, working outwards. And then like we did on the back, we're also going to work the intercostals. I know that's your favorite. That's everybody's favorite. It's kind of a strange one. Most people don't really have any reason to put their fingers in the intercostal spaces unless it hurts. So we are going to just work on the outside and bring this in. So I've got my fingers in the spaces, and we're just going to use this sort of pressure and pumping motion and work medially to the sternum here, just following the lines. It's not too bad. It just feels a little focused compared to everything else, yeah. Okay. There. Now, we can do a last round of the pump technique with the rotary. Go in, alternate. And let that clear out. Okay. I'm going to put this arm down. We'll work the other side of the chest before we get into the arms here. And bringing the arm up. Pretty standard at this point. Arms are always up. Then get all our stationary circles in here. Good. Let's see, so circles, and then working on the chest. Before moving on to the waist, we kind of jump around here. Here, come up. What is nice about this technique is that there are only the 4 main techniques, but the order is where you feel like you jump around a little. Okay. Pump technique, rotary, and it can be, the techniques themselves are a little, they can be a little difficult to get used to, I suppose, especially because oftentimes you're alternating. Okay, and the abdomen here, working out and then coming up. You're always trying to keep in mind where the skin is going. What way are you moving the lymph? What way is it going? You don't want to accidentally be pulling it back in. You want it all go in the same place. chest here. So it's important to remember about pushing the skin, but then completely pulling off the pressure when you're coming back. And then we're going to bring my fingers in here, and we're going to come up the ribs. This is one of the few times where we're working laterally to medially, working where everything's much more open to the origin of the rib. Everything goes right in here. I hope your arm isn't getting tired. Shouldn't be the way it's positioned, but might be getting a bit of a stretch. It's not often that it's in this position normally, yeah. Okay, well, let's go ahead and bring that down and we'll move on. So for your arm, I'm going to take this and we're going to bring it at this 90-degree angle, and I'm going to put your arm back so that way I have access to all of this in here. And I'm going to support your arm so you don't have to hold it up. And we are going to just come back into the axilla. This is our kind of base point. That's why we keep coming back to this. Because we don't want what happens, for example, when it rains. If the ground is already saturated, no more water can get in, that's when you get all those big puddles. We don't want that to happen. So we are going to do some stationary circles here from the elbow into the axilla. And we kind of break the arm up into posterior and anterior here. And we often will work both sides. Good. And if I put the arm down here, then I can work this other side. Elbow to the most proximal part of the arm, of the joint here. Good. And then, if I can have your arm again, I'll just be moving this as I need it. You don't have to help me out at all. I'm going to be doing this scooping and pumping into the upper arm here. Good. And then we can do alternating the stationary circle and the pump technique here on the outside of the arm. Good. Then we'll get into the elbow a bit. Where I'm going to be actually working with the arm, like flexing it, moving it, not just positioning it. So I'm going to take your arm and I'm going to do some stationary circles in the crook of your elbow here, while I'm also moving the arm up and down. So that motion helps do kind of a natural drainage here, natural movement. There we go. And we can do around the elbows here, the epicondyles as they're called. You can do ones on the outside, inside. Good. Just some stationary circles here, turning the arm. And then we can do the scooping from the wrist to the elbow. And I can get one side, then the other. Good. Anything super cool planned for this little cold snap we're gonna have? Shouldn't say cold snap, it's almost winter, isn't it? It is indeed. Yeah, I think it'll be pretty quiet. I mean, I'm thinking stew and big nest of blankets, fuzzy socks and the like. Just sort of a cozy, resting little hibernation season almost. And we're going to do some stationary circles and pump technique. We just really want to clear everything out. We want everything to drain out. So, on the hand here, we will do some work on the palm, and we're going to work from the middle outwards. There we go. One would think it'd be working the middle downwards, but it's actually going to collect along the outside here. Back of the hand, pushing towards letting the skin just carry me back. And each finger gets a little bit of attention. Just bringing that fluid down these. Before we bring everything back to the axilla here. We'll scoop and just ferry this all the way back. last one. There. So the axilla is all done for this side. We're not going to be getting any more into that. Let's go ahead and get into the next part. And we're going to bring this arm up and support it here. And work the axillary area. Okay. And then I'll be able to work the inside of the upper arm here. I'm choosing here to support your arm, but I could use both hands if I were to put it down, but it feels a little easier for me and a little more comforting, I would think, that I'm holding on here. And I can just put that down. Work on the other side. It might be a little quicker if I were to use both hands, but I think just having that bit of support is worth it compared to the time. And around the shoulder here. We'll pick up the arm and do some of our pump technique here. I like taking the time to explain everything on one side and then getting into the usual routine on the other. I feel like it hits both you know what's going on, you know why we're doing what we're doing, you know what it is we're doing. And then I can just focus on the treatment on the other side and to get more of a balance. And then I'm going to be able to do that arm flexing. So stationary circles in the crook of the elbow while I'm flexing the arm. And the epicondyles. This feels nice anyway, especially if you get tendinitis. So that would be like the tennis elbow or the golfer's elbow. And for a long stretch there, I was very unfortunate to often get both. I had to give up crocheting because of it, because I was hitting my thumbs, getting carpal tunnel, and double tendinitis. It's like, I just want to make cute little animals. This isn't fair. This feels real nice for that because that area that hurts is so superficial. Okay. Wrist to elbow. One side and then the other. So I feel like a lot of the work here on the arms feels particularly effective because often these areas that hurt are fairly superficial. It's like with the back, you can't really address back pain very well if you're working super light, but with the arms, it's much easier to also help alleviate any pain. We'll do the pump and stationary circle. And then we'll get into the hand. Yeah, so see the palm here, and we'll work from the middle outwards. On the back of the hand. I think of all the areas, the arms are my favorite. You can do your full breadth of techniques. There's an ease to it. The fingers. And everything's just much easier to access. It's not hard to do it on the arms. It can be a little difficult on the anterior chest and body. And definitely the extremities are a lot easier. Let's go ahead and bring that all together. The entire arm. Good. For the leg, we're going to start here on the thigh. We've got some stationary circles on the upper thigh. And my fingers are pointing towards the abdomen here. And then we'll work not exactly the medial thigh, but a little more in the middle, between the inner thigh and the middle. Okay. Then I'm going to turn my fingers here. And we'll do the stationary circles right in here. So here our big node is going to be the inguinal nodes. So we're going to be bringing everything to that particular node. And we're going to be doing the pump technique here, working from the top of the knee to that little inguinal line there that we worked with at first. And then we can work a bit in the inner thigh, which is going to be right here, if that's okay. Okay, so we're just going to use both hands to bring that upwards, up to the inguinal nodes. Bringing that up, letting the skin carry us back. Then we can do a pump technique with the stationary circle. Just like that, top of the knee, all the way up. And we'll do this on all aspects of the thigh. Okay, medial. I have quite small hands, so this takes me a little bit, but perhaps someone with more normal size hands would have a bit of a quicker time with it. My mom always likes to joke that the rest of me is fairly proportional, but my hands are just comically small. No one else in the family has hands as small as I do, though actually most of them have regular people hands. Some of them are a little large, but I lost the hand lottery, it seems. Okay, now we're going to do some pump technique here on the knee, around the knee here. Kind of over it. I'm working below and then over. And then stationary circles on both sides of the knee. And I'm going to lift this up a bit so that I can get into the popliteal area. And then we'll do our circles back here. Good, and then working down towards the calf here. So the inside, just gonna do our circles. All the way to the knee. Okay, and then we are going to do both sides here. I'm going to bend your knee, and then I'm going to use the pump technique while doing the scoop as well. So the pump is going to be along the shin. Scoop is for the calf. The scooping is good for those big muscles there. This is the perfect muscle for that. Good. That's working quite nicely here. I think that you are my last client of the day. So feel free to just relax. You don't have to be super concerned with bouncing out of here first thing. I'm going to lower the leg here, and then we're going to work the ankle. We're going to use some circling on both sides here. I'm going to use my thumb for this one. This can be kind of a delicate area. And then I can work the back of the ankle as well. And the top of the foot. It's enough area for just the one hand. And the base of the toes. Each one gets some tiny, tiny circles. And then I can just grab this here, and we can use the pump and scoop technique up to the knee, we'll start in with the last area, your other leg. There we go. Inguinal nodes to start. Getting those all ready like we did the axilla. Circles in here. And then we'll do our circles with the fingers perpendicular to the thigh. Good. And we'll have to do some pump technique here from the knee up. Both hands working up, repositioning, circling right in the inner thigh here. And we can do pump and circle all the way up. So when this is done, you might feel a little lightheaded, a little woozy. But we're going to finish with some of that diaphragmatic breathing that we did in the beginning. We'll do our pump technique over the knee here. And that'll help ground you a bit, bring you back. Been doing this very gentle stroking treatment for quite a while. So I imagine your body's really relaxed into that. And circles on both sides of the knee. So it can be a little disorienting trying to get back out of that. But we'll do the breathing and you have some time to hang out if you want. I'm just going to lift your knee here. Behind the knee. And then in the calf here. I think also it's getting darker earlier, so everybody just feels a little more sleepy. I mean, humans may not hibernate, but we certainly do slow down in the winter. So we can just kind of lean into that and take it as a sign that we do need to slow down, whether we want to or not. It's just kind of naturally how it goes. Can't be burning at both ends for too long. I'm going to bend your knee here, and we're going to do the alternating pump and scoop. I bet you those are squirrels trying to get into the bird feeders. Wasn't loud enough to be a raccoon. Let's lower the leg here, and we'll get into the ankle. the back of the ankle. So a treatment like this is certainly effective on its own, but it does, of course, work really nicely as a routine. Could do it every couple of weeks, even once a month would be fabulous. Just something to help support the body's natural drainage, and especially since we're getting into the colder months where everybody is inside a lot more, then this can help support the immune system a little bit, especially with the sinus stuff. Okay, and the base of the toes. Well, this is just a good support technique, supporting self-care technique. Okay, and let's grab the leg here so that we can do the pump and scooping up the leg. And then up the thigh. Massage tables behaved rather well for most of the treatment. This is where it wants to get a little creaky. That's okay. That's pretty much the best behavior that I can expect from it. I am 100% okay with that. There we go. Okay. So I'm going to have you sit up at your own pace, and then we'll do some of that breathing. So I'm going to have you take a deep breath into your abdomen and then out. So deep breath in and out. Deep breath in and out. Deep breath in and out. One last one, deep breath in and out. And that's all there is to it. Is there anything else I can do for you? Alright, well, I'd like to thank you so much for having this manual lymphatic drainage treatment, and I hope you have a whale of a day and a good rest of your night. Thank you. Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything, from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon. Or I also have a Ko-Fi link for a one-time donation, or a throne wish list for props.